as you mentioned aphrodisiacs, are there any aphrodisiacs or natural herbs or vegetables or fruits that men should be consuming that you recommend? I know you probably have your proprietary blend that you can't give up the sauce, but as a general, some basics that guys should be consuming.
Yes. Uh, they can all find that as the Epic Man Sexual Health Program on my website. If you just go there and go to the store, these are formulas that and therapies that I've been utilizing again with my patients, my private patients all this time. And I have now made it available to the public. So they just need to go to drjulissa.com and go to the Epic Man Sexual Health Program. And regarding foods, I love certain spices and anything that is going to nourish the kidneys, which are the residents of the loins, are also wonderful nutrients for the reproductive system. So I love things like cayenne pepper.
Mm.
Okay, red cayenne pepper, wonderful for putting your pain sensors on alert. And don't take that in a negative way, but when you do that, you're more sensitive. You're more sensitive to touch. You're more sensitive to this in certain places that maybe you weren't so sensitive before. So that's a nice additional spice to add to foods, whether it's just sprinkling it on your plate or even sprinkling it in a cup of tea and sipping on that. Um, I do love to bring in kidney tonic foods like parsley, celery,
Mm.
watercress. So anything that are very good nutrients to nourish the kidneys is going to do a wonderful job of also supporting the reproductive system. Um, and then the therapies that I've recommended. Exercise.
Hmm.
Exercise, wonderful for making the blood flow.
Yes.
And when you exercise with your partner, sex is better.
That's true.
Studies have shown that and proved that as well.
Hmm.
One of my favorite exercise to recommend to patients, Dr. Samori,
Hmm.
is the rebounder. Do you know what a rebounder is? Personal
Mm.
trampoline.
Oh, so wait, so like get a trampoline and just jump up and down?
Yes, or do this on it,
Uh-huh.
jump up and down. You can find a lot of guy workouts for trampoline
Okay.
on YouTube. Now, why do I recommend that? It is the only exercise that works every single muscle in the body. NASA has done thousands of studies on the rebounder and the way that it helps all the muscles and the lymphatic system and such. When astronauts come down from space, their muscles are atrophied. They've shrunk like raisins and they can't walk. They wheel them out in a wheelchair. Do you know how they get them walking again? With a rebounder.
Oh, wow.
10 minutes on a rebounder is great bang for your buck. 10 minutes on a rebounder is equivalent to 50 minutes of running.
Wow.
That's my
I need to get
number
me a
one.
rebounder.
Yes, I recommend it. If you know Tony Robbins, my manager and such works along with him as well. The amazing motivational speaker. That's his definite go-to exercise every day, and a lot of athletes also use that in their regimens as well. But there are some athletes even that you can find on YouTube that do awesome male exercise, 10 minutes, 12-minute exercise regimens, and you're done. Life is busy. Let's get
Yeah.
bang for your buck with that. And that's it's an awesome workout to do on that. I do it with weights as well, and it's great.
Wow.
Love
Wow.
handles, and since my guys, after the age of 45 or so, concerned about the love handles and this and that, it's great for that too.
Ah, okay. All right. The rebound. Okay. All right, fellas. You heard that. So y'all need to hit your local sports authority or Amazon and get you one. I'm gonna get me one. Okay. Here's one that I want to talk about. When guys hit 40, prostate is something that they're always saying, like, look, you got to pay attention to. BPH is a thing that has to do a lot with lifestyle and diet. Can you speak a little bit about BPH, um, prevention, management, and things along those lines.
For sure. I've actually published articles on this as well. So BPH, benign prostatic hyperplasia, inflammation of the prostate. There may be some pain involved, in the lower pelvic region, so between the belly button and the groin, in the groin area, okay, below the belly button area. There could be infrequent urination. There could be the sense of dribble effect, that when the man is urinating, he wants to keep going, but only like drops, kind of come out. And the sensation to constantly have the urge to urinate could be something. Constantly also going to urinate. So all of these tend to be symptoms. Sometimes there's pain after ejaculation as
Mhm.
well with BPH. But one common thing that they have found in men that have challenges of BPH and inflammation of the prostate is high estrogen levels.
Mm. Mhm.
Again, we go back to a man that is going through certain shifts. I mean, I'm seeing low testosterone levels in younger and younger men, 30, 32, and that's not normal.
Right.
It's also what people are exposing themselves to, and in a way, just what you're exposed to here, but there's ways to avoid that and ways to offset that, as I mentioned a moment ago. So increasing testosterone levels helps immensely, because then you're doing a contra to those high levels of estrogen, which you shouldn't have. We all have both estrogen and testosterone, but women should have more estrogen and men should have more
Yeah.
testosterone.
Correct.
So that's huge. The high estrogen levels are a huge cause of the inflammation in the first place. Uh, and then just environmental factors, lifestyle habits, and diet. Again, it's the perfect storm that has to be happening for these types of diseases to set in. So, with each individual unique person, yeah, that's why I love this realm of medicine, because there's no cookie cutter approach to everyone. It's all unique to you, an individual to you. When my examination and such, I have to see what's happening there. If I may, um, Dr. Samori, I would love to touch upon how emotions affect the body physically,
Yeah.
how
Go
that's
ahead.
a huge factor. So many men are not very open with their feelings. Okay, you naturally, the man is the thinker, the woman is the feeler. This is why there's that balance of yin and yang. You guys are thinkers, the woman is the feeler. However, in holistic medicine, what I touch upon the most is how our emotions affect our body physically. Best example I can give you, think of how when a person gets frightened, they may start sweating profusely,
Mhm.
or they may even urinate on themselves, right? The emotion came first and the physical reaction came later. In holistic medicine, we know, and I wrote about this in my book as well, the thought emotion of unconsciousness, the unconsciousness thought emotion is the one that affects the reproductive system. Let me explain. I want you to visualize a man that has passed out on his couch and the cognac glass just rolled out of his hand. He wanted to numb his feelings. He doesn't want to feel what's happening in his world. He doesn't want to feel or experience whatever's happening in his circle. He wants to numb whatever he's feeling. So he drank himself into a drunken stupor and passed out. That's the chart that I have in my office actually has that on a scale, and the certain images that correlate to each emotion and the organs affected to it. The testicles, the prostate, all of these unconsciousness, thought, emotion effects. What is it exactly? Building up a wall and blocking your feelings because you're afraid to get hurt again,
Mm.
or you're afraid of someone getting too close because you don't feel the same way towards someone or some people the way you used to. Maybe even saying I care for you or I love you is hard, but it's this,
Mm.
building up that wall. That person wants to numb their feelings. They don't want to feel, they want to just push it away. When I see more inflammation of the prostate or inflammation of the testicle. On the left side of the body, there's a reason why certain things happen on certain sides of the body. You know? If there's inflammation of the prostate, more on the left. If there's inflammation of the testicle, on the left. Then I'm going to ask that patient, who is or who are the female figures that you are blocking emotionally?
Mm.
So first, mother figure in the hierarchy of how we know this in naturopathic medicine. Mother figure, female figures in your life, aunt, grandmother, whatever it may be, spouse, and other female figures. If it's the right prostate I'm seeing in my examination, there's more inflammation. If there's issues of inflammation of the right testicle, I'm going to ask, who is or who are the male figures that you are blocking emotionally? And the hierarchy goes father figures in the life, uncles, grandfather, right? Other male figures, and so on. So there's a reason why certain things happen on certain sides of the body. Well, why did that patient come to me with a a tumor on his right testicle? Here's an example. I have a patient that came to me 18 years ago. It's 2022, so it's now been 18 years. I see this patient, I'm examining him, I see that in my examination, I can see that there's trauma of the right testicle. Okay, and I asked, who's the male figure that you're blocking emotionally? His father used to fondle him when he was a child.
Mm.
When he was 8, he broke his leg, was in the hospital, and you know how you see it in the movies, the leg is suspended with the cast and so on. This is he explained to me. And even when his dad came to the hospital and to see him, fondled him there in the hospital.
Wow.
So the right testicle had a tumor because of that blockage emotionally. I understand this is a horrible thing that happened to him. And yet, so that you can heal, I need the help with the emotional part. Leave the body to me. That's my job, to know what I need to feed this body to help it get back to balance and to heal. But I need your help with the emotional forgiveness necessary. And I go through the steps of how to help patients, because the root cause came from somewhere. This didn't just happen overnight. None of these types of things happen overnight. Cysts, tumors, cancers, inflammation like that of the prostate, EP, none of these things happen overnight. It takes time. And what we know in naturopathic medicine, at least 7 to 10 years back from the day of diagnosis, I need to know what emotional or traumatic event happened in that person's life that turned the problem on like a light switch, and the
Mm.
body responded. That makes sense.
Yeah.
And so, that's just one example.
Wow. 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 That's really deep. That I've never, you know, heard like, in conventional medicine, it's just basically like, like, oh, this is the prostate, and here's things that may cause it to grow, hypertrophy, and but you don't really think about some of that. But it makes sense. Even like you said, the emotion and the reaction. And I can definitely tell you that that is true, because I can tell you a very short anecdotal story myself. One of my old relationships that I had, um, me and the girl had, we would we would fight. Like it was just bad. We were not matching energy.
Mhm.
And it was like we started off good, but then it just got bad. And it was like I wasn't even able to engage in intercourse with her, because it was like I didn't emotionally, I wasn't there. It was almost like I felt like I was sleeping with the enemy per se. And so it was like trying to perform, it just wasn't there. Like you can look at her and be like, okay, yeah, she's attractive, but the it was gone. My next relationship, we didn't have that. And I'm ready, willing, able, like, let's go. And so that emotional thing I think is very, very, very true. Like, your emotions are very much tied viscerally uh, to you. So that's
Absolutely.
that dichotomy though, that left and right, I've never heard that before. That's very interesting. Mm,
That's ancient medicine and holistic medicine. There's a reason why certain things happen on certain sides of the body, and I could give you the cure for that right now. But if that root cause is never taken care of, that's when you hear people saying, "Oh, it came back,"
hmm,
or "Oh, it came back," or "Oh, I'm in remission. I was in remission for this many years, but then it came back." The true root cause was never taken care of. And that's where I've been very successful in helping my patients to truly overcome their challenges overall. That's what we have to do.
mm, right.
Thank you for
That,
sharing that, to open up and be that personal about yourself. I know that that takes a lot of strength.
oh yeah, I mean,
I admire you for that. Yeah.
no, I appreciate that. Just like you said, it's all about being open. The more you're open and receptive to energy and info, it's only going to increase you, optimize you. So, no, real talk, real talk. Um, you talked about the hormonal testosterone, um, BPH. Um, Now, here's something. Share with us a little bit. I saw a little something on your Instagram page and your Twitter, and I think guys kind of overlook this stuff. You mentioned something about I'm gonna get biblical. I'm gonna get biblical.
Okay.
Something about eating apples. Um,
Yes.
you had posted something about apples and some benefits uh to us and to, I guess, epic sexual health. What's that?
Sure, sure, sure. Let me actually bring that up because that way I can share it word for word. I was apple picking with my family in upstate New York.
Mhm,
But I also mentioned a moment ago how smoking and atherosclerosis and arterial sclerosis are, it's when the arteries harden. And if the arteries harden, not enough blood flow can go to the extremities like head, hands, feet, and genital region for a man to truly have an optimum erection, a really strong erection. Strong enough that he feels that he can truly penetrate his partner, because we're talking about a strong erection, not just getting one, but getting a strong one.
mhm,
So, in adding foods to your diet, my friends, apples are a wonderful natural source of fiber that studies have shown helps to decrease the incidence of atherosclerosis and arterial sclerosis, that hardening of the arteries. That happens mostly when people are smoking and they have high cholesterol, high triglycerides, smoking anything mainly as well. So, yes, it helps with the erectile dysfunction issue very much. Mm. I shared how the studies by the University of Illinois showed that the soluble fiber of apples helps prevent and helps in overcoming some of those challenges of atherosclerosis, hardening of the arteries caused by cholesterol plaque buildup in the lining of your blood vessel walls. So this is what results in that restricted blood flow in the arteries and also heart disease, gentlemen. So the soluble fiber in apples helps to lower that incidence of atherosclerosis. So adding all these little aspects are going to make huge differences. Herbal therapies, the diet, the incorporating certain foods like that, exercise and such. All of that is going to play a part.
dope. I hear people talk about consumption of beets being a good thing. Do you agree, or how do you feel about what's your position on beets and blood flow and uh, male erections and things of that nature?
Yes, wonderful question. You're giving away my secret sauce.
My bad. Well,
That's okay.
okay,
In the in the Epic Man sexual health program that I exclusively only used with my private patients, but is now, after much, much, much pressure, and many people asking me, please make it available to the public, because I would only give these things to my patients. Well, now it's available to everyone. I do have and have developed a concentrated, organic, vegan beetroot formula within my Epic Man sexual health program. Now, why? Because it's natural nitric oxide. So nitric oxide is what they use in a synthetic form, in a chemical form to make Viagra,
mhm,
which we know what it does, but it has huge amounts of side effects, including blindness
mm,
and more.
mm.
Okay. And damage of the liver and so much, so much. I mean, for a few minutes of pleasure, my friends, and then a lifetime of illness, I don't think it's worth it. Some men do believe that it is, because I know that that's a part of you, to perform, to feel virile, to feel stamina, and I get it. I've been doing this close to 30 years. So, and I hear it from my male patients. So,
Mhm.
yes, I absolutely use that in the therapies I have on my patients, and it is available to you in my Epic Man program. So, some men don't like to eat vegetables, and it's sad. I feel so sad about that. I feel so sad, so I have to give it to them in a supplement, and that's one way to do it. But the amount of beets that you would have to eat to get what my concentration is when you're only taking two a day is it's very concentrated. And I promise you'll love me in a week.
Wow.
Tell all my patients that you'll love me in a week. You'll be fine.
Right, right, right. Um, I want to ask you one more question, and then I guess we kind of wrap up. I know you're a very busy woman. Um, the consumption of food, right? Because some say, like we could be like, hey, babe, let's go out on a date today. So we'll go out and have dinner, and you want to come home, maybe a glass of wine, come home, and think we're gonna be intimate. But some people say, look, it's better to have sex or better for your performance on an empty stomach. But then some people are like, but you need your food to get the nutrients so that you're strong. And what's in your years of practice? What do you feel about maybe sex on an empty stomach or less food per se? Or
Yes, yes, and yes. You're absolutely right. In Taoist sexual teachings, you're recommended not to have sex on a full stomach. No, your circulation is not the same. Blood, oxygen also to extremities is not the same. So I get it. You're out on a date, and it's a beautiful thing. Give some time before the intimacy happens. Hopefully a couple of hours have gone by after the last bite.
Mhm.
You're now lingering and just chatting over the last, I guess, glass of wine, or I'm not condoning per se alcohol, but just give some time afterward to be able to perform at your best, truly. On an empty stomach, even better. Maybe eat afterwards when you guys are ready to just supplement and nourish the body again. But yes, it is recommended not to on a full.
Uh-huh. Um,
Mhm.
Actually, I do have one more question. I do have one
Yes,
more. I do have
please.
one more. I lied. I
Bring
lied
it
to you on a
forward to you
Saturday.
also.
I
Yes, go
lied
ahead.
to you on a Saturday morning. Um, what is your position on coffee and male libido and performance? If you have any information on that, and also consumption of alcohol. I know pretty much most people are going to say like alcohol is definitely like not a no-go, but then you have some people that say, hey, red wine is good for you, but then it's what type of alcohol are we talking about? So coffee and alcohol, male performance, what's your take, Doc?
I do not recommend coffee.
Mm,
No. recommend coffee. Again, I've been doing this too long, treated too many cancers, helped too many couples with that have come to me with fertility challenges. And just on a side note, and I wrote about this in my book as well, uh, those that intake 300 milligrams or more of caffeine, toxic caffeine per day, are twice as likely to suffer from delayed conception, twice as likely to not get her pregnant, for example.
Wow.
Oh, well, then what is 300 milligrams? Don't even calculate it. Like, just if you're if you're trying to get her pregnant and you really are having certain issues, health problems, cut it
Abstain.
out.
Mhm.
Right. Ixay nexe, as they say, like mix it. So what I love for men, can I tell you what I share in my book? Love, love, love for men, green tea.
Mm,
Wonderful for fertility for men. Write that down. Wonderful.
green.
Organic green tea. Get yourself some tea bags of organic green tea. And if you want to lose belly fat, have at least 5 cups a day.
Oh, wow.
Yes. But it's what that's wonderful. White tea for women. Wonderful for her reproductive system. Green tea for men. Excellent for your reproductive system.
Mm,
If, if people actually took, Dr. Samori, the actual coffee cherries, the cherries, and they brewed the actual coffee cherries, then maybe that would be a healthier beverage occasionally for a human. However, it's the hydrocarbons that are produced in the processing of coffee beans that is purely toxic to the
mm,
body and causes severe inflammation, inflammation of the joints. Oh, my knees hurt. Oh, my lower back. Oh, my shoulder. Oh, I pulled this. Oh, I pulled that. Oh, my ankles. It's pure acid you're pouring into your body.
mm.
Okay. And I know that there are huge industries with regards to that. Okay, I get it. But it's abused a lot. And it causes people to be addicted to it. No good, right? So a better substitute, green tea. For men, you want to perform much better, do the green tea. So much better. And it's an anti-carcinogen. You're preventing cancer.
Wow, wow,
Okay.
wow.
Um, so as far as alcohol, let's talk about alcohol. Let's talk about beer.
Okay.
So beer is derived from hops. I don't know if you knew that. It's an herb called hops. Hops is what I give patients that are nymphomaniacs.
Wow. Okay.
Hops, hops is what I use with a teenage girl that parents brought to me that is way too promiscuous.
Mm,
Hops is what I use to decrease sexual desire.
mm.
And then I've had so many patients in the past, male patients, that tell me, but Dr. Julissa, I drink beer, and I'm going to get blunt here. I'm a little blunt, so I hope you've already
No,
met.
I love it. I love it. Be blunt, graphic.
Okay.
Yeah.
I have patients that have told me, Dr. Julissa, I drink beer because it cleans me out and I pee like a racehorse and it just cleans me out. Oh, problem is this. Your prostate, think of it as a rubber band. And so you're drinking beer and you're forced to urinate so much. I want you to think of it as a rubber band that just stretches and stretches, and the prostate stretches and it just stretches and it's because you're forcing yourself to urinate so much because of the alcohol. And then there's the hops and so on. And it stretches, 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 and
Mm,
just, you're
right.
irritating the prostate. Okay. So no,
Mm,
I don't recommend to go crazy with that. Um, uh, when it comes to wine, they you're told, oh well, the grapes and the antioxidants regarding the grapes and so on. I just recommend that you definitely, if you're going to, drink any, not that I'm condoning alcohol,
mm,
if you're ever going to drink a wine. Please make sure that it is organic,
Hmm.
and that it doesn't have the chemicals in it that cause severe inflammation as well. Um, the wines that from what I understand, maybe from Chile, I believe it is, and Argentina, many of those are not going to have those chemicals. You remember Monsanto and all those chemicals that,
Yep.
yes, yes. So be careful. Just make sure that it's, if you're going to enjoy it, try to have the best, and let it be as organic as possible. That doesn't mean to go crazy and have 3 bottles in one night. That's not what I'm
Right.
saying. I have to be careful when I say certain things. I've just learned, because then, I say what is that something may be okay, and then people will overdo it.
True. True.
So that's all. I'm not saying that that is something that you're going to want to do and then immediately think you're going to have the best sexual performance. Not the case.
Hmm.
Not
Hmm.
the case. If you're trying to help your partner conceive, also, definitely alcohol is out in
Hmm.
those 90 days. I'm helping to balance their bodies, because you want all of the best of you, the best genes, the best of everything of the both of you to go into that sperm and that egg that are going to come together. And you don't want drunk sperm when you fertilize that egg.
Hmm.
Just no.
True. 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 That's real.
Yes, so yeah, it's kind of common sense, really. It's just natural.
Right. 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 Wow. All right. Well, hey, listen, you were dropping jewels, man, and we're gonna have to get you back on, some other times whenever you're free and available. But I want you to make sure that you give the viewers of this all your information, the title of your book, where they can go to get your book, your Twitter, your Instagram, your Facebook. What's the goods? Give it up.
Oh, thank you so much. Well, you can all find my information at drjulissa.com. That's drjulissa.com. And there you'll find the sexual health and Epic Man and Epic Woman also programs that I give to my patients. As far as social media, I'm on 6 social media platforms, 7 social media platforms, 2 Facebook pages. Just look up Dr. Julissa or Dr. Julissa BCND. I'm on Twitter as Dr. Julissa, on Instagram as Dr. Julissa as well, and LinkedIn and Pinterest. 7, yes.
Wow, wow,
All
wow.
of those, yes, yes. And then there's also my podcast, which is on iHeartRadio and Spotify, Epic Sexual Health with Dr. Julissa. And it was such a great conversation with you, Dr. Samori.
Oh man. Yes, yes. No, thank you. It was dope. I took my notes. So I'm like, wow, some of this stuff I'm gonna implement myself, so um I hope these guys that watch this, take note, listen to what she said, check out her website, get that information. So, your woman will be like a koala bear ready to climb that wood.
Wonderful.
But yeah, with that said, I guess we're going to conclude this episode. Hopefully, we'll have Dr. Julissa Hernandez back in the building sometime in the near future. And with that said, Swarthy and Swank, we are out of here. Peace.